And Dr. Geeta Modi apologizes that she cannot be here tonight. So what is the problem? Well, the problem is reality. So this is a 70% of all medical equipment in sub-Saharan Africa is lying idle due to, among other reasons, the absence of user training and effective technical support. And experiencing this firsthand, I could attest to that. This is my walk down one clinic in Rwanda. The hallways is filled with deactivated equipment. And so what's the need? Well, the need is to actually design for these environments, and then you will have these globally applicable devices that not only are applicable in the developing world, but could reduce healthcare worldwide. So let me give an example, which is our device. So chronic wounds are a significant problem. There are venous pressure and diabetic ulcers, and this is a huge problem when the aging population is increasing and diabetes is increasing. 1 to 2% of us in this room today will have a diabetic or venous or pressure ulcer in our lifetime. The prevalence is 44 million worldwide, 4 million in the US alone. They take months or years to heal and are the leading cause of amputations. So the main problem is the devices that exist for negative pressure wound therapy that have been proven to heal these wounds. They cost about $100 a day for a 4 weeks to 4 month therapy. They take upwards of 70 watts of electrical power. They're limited in portability. They weigh about 10 pounds and are pretty bulky. And they have this complex computer interface that needs some significant training and have a learning curve. And we designed the wound pump. So it costs $3 a day to manufacture, or $3 to manufacture. It takes no electrical power, so it's purely mechanical. It's very portable. Here it is. Weighs less than half a pound. And it's easy to use. It's a plug-and-play interface, one-time operation, and one way to use it. So, simply, it works. In the Haiti earthquake relief effort, which there were donated devices that exist today, they were donated, they couldn't be used without electricity. We went down there and we treated about 300 patients a day, 5 with our device because their wounds were clean enough to treat. And we proved that in a disaster relief setting, where you would typically change these gauze dressings, the standard dressings, once a day, now you only have to change this every 3 to 5 days. So one caregiver can now treat at least 3 times more patients. And we proved that it's very feasible in a disaster environment. And then during our phase 1 clinical trial this past year in Rwanda, the patients not only thought that their wounds healed better, but also that they wanted the device on them because it was a less painful wound treatment because this doesn't need to be changed as often. And the clinicians thought that it was easy to use and that their wounds looked better and healed faster. So in our future, we're looking to contract manufacture these devices and do a phase 2 clinical trial in Rwanda, receive FDA approval, and develop WeCare that not only pursues these devices, but more devices like this in the future. Thank you.